Welcome to the Bodyguard podcast, where science meets natural healing to uncover the root causes of complex health issues. Your host, Christine Barnes, is a leading complex case health practitioner specializing in functional testing and personalized care. This show dives deep into clinical analysis, cutting-edge diagnostics, natural therapies, and holistic strategies to optimize your health and well-being. Your health is unique. Your healing should be too.
I'm a bit of a health detective and someone who spent most of her life figuring out the body's hidden language. Today, we're talking about a test that I honestly believe every chronically and unwell person should know about. And yet, most of the general public, most medical practitioners, and even naturopaths have no idea it exists, let alone what to do with it. It's called a HTMA, hair tissue mineral analysis, and it's an absolute goldmine when it comes to understanding what's really going on in the body. I'm going to break it down for you. What a HTMA actually is, why I recommend it to so many of my clients, and how you can get it done simply and painlessly. So if you're dealing with fatigue, burnout, menopause, thyroid, mood issues, or you're just feeling like no one's found the root cause yet, you're going to love this one. Let's start with the basics. HTMA stands for hair tissue mineral analysis. It's a lab test that looks at the mineral content of your hair. Yeah, your hair. Now, I know that sounds a bit woo-woo at first, but hear me out. Hair gives us a 3-month snapshot of your cellular mineral levels. So quite unlike a blood test, which shows what's floating around or circulating in the blood, and that's always being managed by the body to maintain a balanced, what's called homeostasis, or balancing your biochemistry in the blood. So it's not actually representing what's going on. HTMA shows us what your cells have actually been doing over time. It was originally used in environmental medicine, and I find this really fascinating. It was used to test for heavy metals like lead, mercury, arsenic poisoning in the very old days, and it's still great for all of that. And we now know it's also an incredible tool for assessing essential minerals such as magnesium, calcium, zinc, copper, sodium, potassium, all the stuff your body uses like spark plugs to run everything. So quite important. And here's where it gets really interesting. It's not just about whether your minerals are high or low. It's about ratios and patterns. Let's take sodium. Just as an example, it compares to your potassium. That tells us a lot about your adrenal function and your state of stress, or your calcium to potassium ratio, which can reflect your metabolic rate. So it's not just about the numbers, it provides a story of where you've been and where your body is at right now. So why do I love this test? Why do I talk about it so much? Because these minerals we're talking about are foundational. You can have a perfect diet, take all the right supplements, do all the right things, but if your mineral balance is off, your body just can't function properly. Here are a few real-world examples. Let's say someone comes to me with fatigue that's been dragging on for years. They may even consider themselves that they've got chronic fatigue syndrome. They've had all the blood work, their iron looks okay, thyroid is normal, but they're exhausted, they're foggy, they're irritable. We do an HTMA, and guess what? They're a slow oxidizer. So this is the result of certain patterns in minerals that can tell us whether it's slow, fast. So slow oxidizer, their metabolic rate is crawling along. The magnesium and calcium are way too high in the tissue, which means they're not being used properly. The sodium is bottomed out, which is a classic sign of burnout. Or maybe it's somebody with anxiety and mood issues. Blood tests, all fine, but the copper is sky high. Zinc is low. That copper-zinc imbalance. It affects neurotransmitters and detox pathways, to name just a couple of points there. Thyroid issues. So if somebody presents with thyroid issue, HTMA can pick up on low tissue potassium, which the thyroid needs to work effectively. even if your thyroid stimulating hormone is technically what's classified as normal. And here's the kicker. Your blood will always try to look normal, as I mentioned earlier. And that's its job, by the way, it keeps minerals tightly regulated, which is important. So even when you're scraping the bottom of the barrel, blood can appear fine because your body is borrowing minerals from tissues, including your bones and organs, in order to keep the blood in balance. HTMA lets us see what's happening behind the curtain. So how do you actually do a HTMA? It's super easy. No needles, no fasting, no appointments. You can do it at home. It's simply taking a small sample of hair from the back of your head, as close to the scalp as possible, but only need about a tablespoon worth. So it's not much. If your hair is really short or if you don't have enough scalp hair, we can also use pubic hair. Or we've got some other options as well. But here are a few things to keep in mind if you're considering doing a HTMA. We don't want to take a sample of dyed or chemically treated hair. So if you've just had your roots coloured, you want to wait about 4 to 6 weeks after the dyeing. So I generally find about 4 weeks gives us enough because we're not using the length, it's actually the regrowth. Wash your hair in clean water with basic shampoo. So no fancy coloured shampoos or special treatment shampoos, no conditioner or styling products, at least 24 hours before cutting the sample. Use clean stainless steel scissors, please. So not scissors that you're cutting aluminium foil with that may leave small traces, or scissors that you may use for other things. I even recommend sometimes it's a good idea to keep scissors that are specially for doing these tests, because eventually we want to do a retest as well. So once the sample's ready, you send it to the lab. Now, for my patients, we email the instructions, a link of how to watch a video on how to take the sample, and a little envelope that you can cut out and you can actually stick together to put the sample in. Please, I recommend not using Ziploc bags. We want to put it in a paper envelope if you don't have any other choice. I use a trusted lab that I've used for decades, and it's the only type of test that they do. The results come back within about 14 working days, and that's when the real work begins, the interpretation, and that's what I do. So I don't use algorithms or any computer or even AI. I interpret it in relation to the patient, and every interpretation is done in a highly individualized way. Because here's the thing, HTMA is not a do-it-yourself test. You don't just look at a high magnesium and think, great, I've got plenty of magnesium, I don't need to take a supplement. Often, high minerals on a HTMA actually indicate that you're losing the minerals. And it takes an incredible amount of experience to read the patterns, the ratios, and even hidden messages. That's how I help my clients with it. We don't just test, we translate. So to wrap it up, HTMA is a simple, non-invasive, easy to do even with babies and kids. It's a test that gives us powerful insights into how your body is functioning at a cellular level. It's proactive, it's functional, and it can be the missing link for many chronic symptoms. So if you've been told your bloods are normal or there's nothing wrong with you, it's all in your head, but you know something's off, this test may be the next step. In my clinic, it's the first step. I offer HTMA testing and deep individualized interpretation as part of my clinical work day to day. If you feel you're curious or want to learn more about what I do, how I work, and maybe want some more information about other testing, functional testing, head over to thebodyguard.com.au or find me on Facebook or Instagram, send me a message, and even send me an email, clinic@thebodyguard.com.au. Myself or one of my team will pick up that question, and I'd love to hear your thoughts on this episode as well. So please follow, share, post a comment, and thanks for listening. I hope you found it helpful today. Be kind to your body, stay curious, and I'll see you next time.
That's a wrap for this episode of the Bodyguard Podcast. We hope you found valuable insights to help you take control of your health journey. Want to dive deeper? Visit thebodyguard.com.au to learn more about our work, explore resources, and discover how personalised care can transform your well-being. If you enjoyed this episode, don't forget to share it with others on social media. Your support helps us reach more people looking for answers. Until next time, take care and keep prioritising your health, because your healing should be as unique as you are. Please note the information in this podcast is for educational purposes only and not a substitute for professional medical advice, diagnosis, or treatment. The Bodyguard accepts no liability for any loss or damage arising from the use of this content. Always consult a healthcare professional.